Coming to my talk, I'll be talking on the challenges which comes while working in a government sector. So with the challenges, the opportunities also comes for arriving at different solutions.
So CTN.
So with the challenges comes the solutions and opportunities also. Now, working in a government sector is a little different from working in an institute which is independent financially as well as from decision making point of view. So I'll be talking about the CTN. Dr. Gopal Pillai has already talked a little bit about it. Establishment. What are the challenges and solutions in the government sector? Then the subject selections, data collections, entry verification, and validation process. I think partly it has been covered by Dr. Gopal Pillai and Manojit also. And what are the industrial challenges? Since the primary principle and the primary objective of this IOCTN was to create a network which will provide opportunity for biosimilar creating pharma industry to utilize the data in order to create different trials, and this registry could have worked on that question. So this is a government sponsored trial. That the name appears to be trial network, but basically this was a clinical registry in the initial phase. So patients were registered, and the good clinical practices were followed in registering those patients, recording their data, interpolations of the data, and finally regarding the objective was to identify how better we can utilize those data. At the same time, it was also regarding creating the trained manpower for working in the network. We know that in different CROs, they are working through their own private network. Now, here comes a government sponsored network which was creating a working hand and a trained manpower pool to work in these areas. So, National Biopharma is an industry academia collaborative mission of Department of Biotechnology, and this was through implementation for the early development of biopharmaceutical. This was the basic aim, and the BIREC started trial in different diseases also, not only in ophthalmology but also in diabetes, also in cancer registry. So multiple trials were started at the same times, and that's how these six institute came together. Dr. Rajvardhan Azad was the person who basically brought all these six institute: AIMS Kochi, RIO Patna, RIO Trivandrum, SNC Chitrakoot, SSDN Guwahati, and AGH Mumbai. Now all these institute have their own positives and negatives. So we know that in the government sector we have pool of patient, but we are little disorganized. Whereas persons who are working at SNC Chitrakoot or SSDN Guwahati, they are well organized with good number of the patient inputs. So these challenges need to be addressed when we started establishing this. And so those challenges started coming in once we decided to get into the MOU. The MOU was signed, and so the challenges started coming in. The first challenge was to have a clearance from the biomedical for environmental safety. So you know that in government sector you have to comply with principles and the various laws of the state government, and those are very stringent ones. So one has to get all those clearances not only from the biomedical or the Bihar State Pollution Control Board, but we have to get understanding and the clearance from the institute. We have to get clearance from the state government also, since we were supposed to share the data with other institute. So it was little challenging for us. So grant letter was signed, memorandum of understanding was signed, and grant release was, it came in 2020. Now the next challenge was, once we get into the agreement, was to hire good kind of people. Now you know that in government sector, hiring itself is challenge. There are certain laws, you have certain reservation policies. Now whether these manpower will be out of preview of those laws or will be under those law, that has to be addressed, because one wrong hiring of person can create problem for the whole city. And so it took nearly 4 to 5 months for achieving those goals in hiring a good number of people, and those who were finally trained for this clinical network. The next challenge was, as discussed by Dr. Gopal Pillai, we have, our institute is having ethical committee meeting every fortnightly, after every quarter. So after 3 months, you get the chance to get it cleared, whereas the requirement was little different. So we have to synchronize, we have to manage our projects according to our IEC. However, in during the COVID time, the ethical committee decided to meet on the basis of urgency of projects also. So that opened a kind of window for getting clearance at appropriate time. So then initiation of CTRI was important. Then NABL accreditation. Our lab is one of the best lab in the state, but that is not NABL accredited. Now the CTN network requires NABL accredited lab reports. So we have to go outside our living our own lab to a NABL accredited lab. That itself required a challenge, created a challenge. We have to get clearance from the institute, we have to get clearance from the department, then only we get into this accredited lab agreement. Then came the patient expectation. Now our patients are not paid patients. Most of the patients are unpaid patients, or they pay barely, and they come with some kind of expectation. So once you start registering them, call them for this consenting and other thing, they expect that something good is going to come their way. And once you say that no, it is not attached with any kind of the financial benefit or drug benefit or any other benefit, they get demotivated. So, but somehow those challenges were those challenges were well taken care by once the trained people came into place, and they started motivating patient to get into the registry network to create the data pool. So coming to the CROs, they were looking for ARMD per patients, but most of the patients were diabetic patients. So another challenge was that in our government setup, there is no SMO working, but private entities or individual work under the Department for Clinical Trial at that site. So these SMOs are, I think, market-wise, they are better trained than our people whom we have trained. They are ethically and GCP-wise, they are better trained, but ethically they might not be matching those SMOs who are coming through a private sector. So at our center, we have conducted already 8 trials in last 13 years. Few trials are also under pipeline, but still the challenge is how to utilize this trained manpower for further clinical trial network or the further clinical trials also. So another opportunity was to create kind of capacity building for these kind of activities. Before this trial, most of the patients or most of the trials were having private SMOs, so we were not forced to create the infrastructure. Now our labs are with well oriented and also well structured to basically handle these trials. So this was an opportunity, and that was a gain. So what we got, so CTM ophthalmology is the first national registry, started at RIO. it attracted a right qualified candidates, and also we trained the persons. The CTN also developed from the zero level, but now we have a pool of manpower with good clinical practices, training programs, and bioethics, and we have developed a universal module for joint ventures also. So this is what we got from this whole thing. Out of this period, we have already registered around more than 5,000 patients. Out of that, 816 patients were from RIO Patna. The network also created a kind of outreach program also to attract patients, to let them know how this trial network is going to help them, these patients. So to conclude, IOCTN has created opportunity to regulate our site in term of working as a team in coordination with other site. It was learning from other team members also, from their positives. The staff training was a positive, big positive. Capacity building was a big positive. Robust documentation. I'll say we were unorganized sector, seeing a lot of patient but without data. Now our retina unit is having one of the best documentation out of all the different units working in the department, and that's where the opportunity started coming in, and that's why we agreed to extend the clinical trial network to other units also, so that at least the first gain will be a proper documentation in all the sectors. So this is now GCP compliant and large database creates. So thank you very much to all the team members who have worked on this project.